Today we're going to look at intravenous therapies. Intravenous therapies are commonly used in healthcare. They're often used when the clients are unable to take food and fluids, and they're an excellent method for supplying fluids directly into the intravascular compartments and replacing electrolyte losses. Nurses are responsible for administering and maintaining IV therapy, recognizing risks, intervening as needed, and making sure the clients have appropriate health teaching. The intravenous therapy required is ordered by the doctor. In the past, we used glass bottles. Nowadays, it's typically plastic bags. However, if a medication or fluid is being administered and it's incompatible with plastic, we will still use glass. Fluids and electrolytes. What are they? Fluid and electrolytes are essential for a healthy body function. Make sure you review how fluids and electrolytes act in the body. There are some good videos here on Blackboard, and it's important to understand the difference between osmosis and diffusion, as this dictates how IV fluids move in the body. Intravenous fluids are infused directly into the bloodstream. This means that there's a high risk of infection as we are breaking the skin barrier. It's important to practice routine infection prevention and control and wear the appropriate personal protective equipment as we are potentially exposed to body fluids. It is important to assess the client carefully prior to working with IV fluids to ensure that the patient is not at high risk for infection. Patients who are immunocompromised, for example, or have an infection will require extra precautions. The nurse will need to assess the catheter site and the IV regularly. There are a number of things to assess for. These include the site itself for signs that there is a problem, such as heat, swelling, redness, pain, fluid infiltration, extravasation, phlebitis. We also need to check and ensure that the client is receiving the appropriate amount of fluid, not too much and not too little. To reduce the risk of infection, the nurse must make sure that they've washed their hands appropriately and cleaned the site appropriately as per agency policy. It is important to check the dressing on the site. Most IV sites are checked every hour to ensure that there are no complications, both localized and systemically. So what do we use? Gravity or a pump. If we are administering something that is of high risk, such as a medication or a fluid that could cause significant complications for the client, or we're working with pediatrics or older adults, we will use infusion devices, such as an electronic infusion device, EID, or an infusion device that can be manually set. There are gravity devices that do not require an electronic device. However, they need to be checked regularly to make sure that the drip rate is infusing at the appropriate time. We typically see gravity infusion when we don't have an electronic pump, when the client is not high risk, or in home care situations. There are a variety of different electronic infusion devices the nurse may use, and most agencies have their own company that they use, so nurses will be educated how to use the pumps when they go to that particular agency. How do I choose which pump to use? It depends whether it's a central venous infusion, a pediatric infusion, whether there is total parenteral nutrition going in, whether it's a vesicant medication. That means that it is a medication that is highly irritating to the veins and tissues, and whether it's a high-risk medication. Manual or gravity flow is appropriate for most IV infusions and for subcutaneous fluid infusions such as hypodermic lysis. Let's review some of the IV equipment. The first device is the IV catheter. The IV catheter is what is inserted into the patient into the vein. It allows the infusion of fluids, medications, and blood into the patient. The next is the catheter stabilization device. This is important as it prevents the dislodgement of the IV catheter. Nurses must check this on a regular basis. The next thing is the solution container. Typically, these are plastic bags. We need to check these to make sure that the fluid is not contaminated or cloudy, that there's no signs of any items in the bag itself, that the bag itself is not damaged or leaking, that it has not expired, and that it is the appropriate fluid that has been ordered by the doctor. We need to make sure also that the bag has not been previously opened. Next, we will require an administration set, and depending on the type of fluid being administered to the client, that will dictate the administration set. Sometimes we require IV filters. For example, when we are transfusing blood, we will use a specific filter. And finally, a simple but necessary device is an IV pole of some kind. It can be independent or attached to the bed. It can stand alone, or it could have an IV pump on it. This has to be set at the correct height, particularly when gravity IVs are running, to ensure the correct flow rate. There are 3 types of IV fluid: isotonic, hypotonic, and hypertonic. Typical infusions run with isotonic solutions. What are some isotonic solutions? Intravenous solutions can be used for fluid replacement, they can be used for nutrient replacement, and they can be used as volume expanders. It's important to understand why the doctor has ordered that particular fluid, tied in with the patient's diagnosis and the purpose for the fluid, in order to make sure that the right fluid has been ordered. Should an incorrect fluid have been ordered, you will need to call the doctor to address this issue. Regulating IV infusions requires math. Please review your IV formula as well as the IV formula for gravity. So, what do we do next? Well, let's apply nursing process. We have to check the patient's IV site, the risk for fluid volume excess, risk for complications, and any allergies. We need to check the doctor's order. We need to know what type of fluid has been ordered, how much has been ordered, the time that the fluid has to infuse over, and if there's any medication to be added to it. When we're planning and setting up, we need to make sure we've obtained the appropriate equipment. We have primed your IV tubing, and we've calculated the infusion rate prior to going to the patient's bedside. We need to prepare what we're going to teach the patient about this IV fluid. Remember, the patient could ask you what the fluid is, why it's administered, and you need to teach them also what to watch out for. You also need to identify what infection control precautions are necessary, routine or other. When you're implementing your IV infusion, you're going to assess your patient every hour, or more frequently if there's a high-risk medication or fluid being administered. You need to document and report accurately, and you need to check the site for complications during the infusion, including the rate, the time to completion, is it running to time, and any other signs and symptoms. Checking in with your patient. Make sure that when you're monitoring your IV infusion, you're looking at the type of fluid, your infusion rate, the patency and flow, and that you're checking the IV site. Some common complications to note at the IV site are infiltration, extravasation, phlebitis, and hemorrhage. we want to evaluate the effectiveness of the infusion as well as any potential risk for delayed complications. So what are some complications related to intravenous therapy? Well, there are localized complications such as ecchymosis, which is bruising, or hematoma, which is a collection of blood underneath the skin. There can be infiltration. Signs of infiltration are actually where the skin will feel cool. There may not be any redness, but there's likely to be some swelling. And because the fluid has infiltrated the skin and gravity works, we need to look underneath the arm because the fluid could be there. Note that IVs can still run when infiltration is occurring. Extravasation is a very significant, serious complication at the site. It typically happens whenever a vesicant medication or fluid is being administered. That means it's very irritating to tissues. It can very quickly damage tissues, and this is why more frequently than 1 hour assessments may be required to identify if there's possible extravasation occurring. The patient will complain of pain, often severe pain. There'll be redness and swelling at the site, and it'll be changing very rapidly, so make sure you pay attention to that. Phlebitis is another common complication. This is inflammation of the vein, and typically we can see like a red mark or line in there. We can see thrombosis potentially and thrombophlebitis. Thrombosis is where a clot can occur, particularly if an IV has been left in a long time. You can see from the images here, these are actual visuals of patients who have sustained significant adverse effects from IV therapy. Infiltration, you can see the swelling here. Extravasation, this is in an infant who was receiving IV medication, and you can see that the tissue is damaged, and this tissue is going to go necrotic. It's a very significant complication. In this patient's case, there's infection, and you can see the redness, heat, and swelling. So there was some kind of contamination of the IV site. There are also systemic complications that the nurse needs to assess the patient for. Step back and look at the patient. Is the patient having any difficulty breathing? Does the patient have any fever? Is the patient having difficulty and complaining of chest pain? Is the patient exhibiting edema, particularly in the lower limbs? All of these are signs of systemic complications. The most common systemic complication is fluid volume excess, where the patient has received too much fluid, and they will typically complain of having difficulty breathing. They may have a cough, and you'll typically see edema in the peripheries. This is most common in older adults and children, and the nurse needs to assess for this. Preventing systemic complications are important. That means make sure you're using strict infection control and sterile technique. IVs that are sited in lower extremities, such as the legs, are at high risk for forming blood clots. When you're administering your IV, make sure that there is no air or foreign bodies in the IV. Check for kinking or bending in the IV site. And make sure you check your IV calculations and flow rate for appropriate speed. Look for fluid volume excess and signs of pulmonary edema. That is your cough, your difficulty breathing, and your edema. Know the signs and symptoms and risk for speed shock. That's usually with small IVs where it's gone in too quickly, and make sure you've assessed for potential allergic reactions before you start and for allergic actions while the IV is being administered. This has been a brief overview of intravenous therapies. Make sure you have completed your lab manual questions and completed the learning activities embedded within this video.